Hello, everybody. I'm John King in Washington. Thank you for sharing your day with us. We are again at a coronavirus crossroads, a back-in-time moment that should give us all pause. The nation's most populous state is reinstating stricter stop-the-spread restrictions. And its two largest school districts, Los Angeles and San Diego, say the numbers are so bad they already know children will need to learn from home this fall. Because of its size and its diversity, California is often a first alert. And our state-by-state coronavirus tracking makes clear, you see it right there, a lot of places at this moment anyway are trending in the wrong direction. The president won't acknowledge this. In fact, he flat out ignores it, saying those talking about slowing the reopening or keeping students at home are trying to hurt his re-election chances by hyping the coronavirus risk. Once again, though, is the president's own advisors making clear he is out of touch with reality. Listen closely.
We all know that kids need to be back in school physically for all the reasons we talk about: social and emotional health, nutrition, eye screening, discovery of child abuse, all those things that are very important. But we have to get the virus under control. And if we get the virus under better control, clearly kids can get back into school safely.
The but and the if right there are quite telling. Unlike his boss, Admiral Giroir is willing to acknowledge the science and acknowledge the obvious. The virus is not under control today. And if things don't improve considerably, back to school in many places will just not be safe. The Admiral does say he does see some light at the end of the tunnel. How far off is that light? Well, the mayor of Philadelphia just today making clear he sees a long road ahead. The city today, Philadelphia again, says all large public events like festivals, parades are prohibited, get this, through February 2021, 7 months from now. The judge leading the coronavirus response in Houston says if you want a better new normal anytime soon, Americans need to put on a mask, stay out of bars, and think about others.
We have to bring that curve down, and the more we buckle down, the faster it'll come down, the faster we'll be able to drop our kids off for school, to ask them about their day, to get on with our economy, not fully open until there's a cure or a vaccine, but a new normal.
The numbers in our map tell us the challenge is as great as ever. Let's take a look, and let's just start with a number. Look at this right now. The 7-day average of new coronavirus cases here in the United States now above 60,000. That's never happened. This is the first time our 7-day average of new cases is above 60,000. You see the current average just shy of 61,000. You go back in time to the middle of April when we thought we might be at the peak. It was 30,000 back on April 26th, the 7-day average of new cases. Look at that. That's April, 30,000. Here we are today, over 60,000. The summer surge is with us. Let's look as we go through to the trend map right now. This map is just plain ugly. There's no other way to describe it. 37 states have their cases going up this week compared to last week. 7 of those states a 50% higher rate of growth in their cases this week than the week before. That's the darkest red. You see it there. 7 states, the beige holding steady. 6 going down. You see the lighter green states out there. Those are the 6 going down, but 37 states heading in the wrong direction. This is also a warning sign here in these states. Look at the positivity rate. South Carolina, 17% plus. Florida, almost 19%. The same in Mississippi, 17%. In Texas, more than 26%. That means, yes, there's a lot of testing. The people in those states taking the tests, high positivity rate turning back. That means they do not have the virus under control. If you look at Arizona, perhaps, and let's hope, a glimmer of hope here. You see the 7-day moving average starting to trickle back down in the last couple of days. Let's hope that continues. Perhaps Arizona starting to reflatten the curve there. Hospitalizations, too. You see the rise in June and into July. Some indication in recent days that that might be flattening, so perhaps Arizona starting to flatten. We'll keep an eye on that. Florida has been a point of conversation for months, but especially in recent days as it sets daily records. You see here the 7-day moving average still trending up in Florida. Yesterday's case numbers not as high as the days before, so we'll keep an eye on this, but the 7-day average, which is how you track it, it's best to track averages heading up, which is why we start with CNN's Rosa Flores live in Miami for us. Rosa, every day at the top of the program we've had some numbing numbers. Where are we today?
You know, we're waiting for the Florida Department of Health to post those numbers. But, John, we're also learning about a new concern in Florida, the need for medical professionals. We're learning from Jackson Health this morning that 200 of their employees are out with COVID-19. That means they're going to be out for 10 to 12 days. And the positivity rate of all of the employees that they tested is 23%. Governor Ron DeSantis announcing yesterday that he is upping the number of medical professionals that are going to be deployed across the state from 1,000, which he announced last week, to 3,000, which he said yesterday. An infectious disease expert here in Miami-Dade County calling Miami-Dade the epicenter, comparing it to Wuhan, China. Here's the reality on the ground. The positivity rate up to 28% yesterday. This is according to county data, which also shows that in the past 13 days, the number of hospitalizations have increased by 68%, the number of ICU units up by 69%, and the number of ventilators up by 109%, which begs the question, how much time does Miami-Dade have? How long is it going to take before leaders here shut down? Here is Miami Beach Mayor Dan Gelber.
I suspect if in a week or two this is not changed in any way, then we're all going to do it. And whether or not the governor wants us to or not, we'll do it. The county will do it. Lots of the cities will do it. It'll just be a shelter in place again.
And John, we checked across the state, 48 ICU hospitals are at capacity. That means there are no more ICU beds. 8 of those are right here in Miami-Dade County. John.
Rosa Flores, again, important reporting on the ground for us in Florida. Rosa, thanks so much. And when you listen to the mayor there say a week or so, maybe he may not have that long to wait. Let's dig deeper now on the numbers and the trends. Dr. Celine Gounder is an infectious disease specialist and an epidemiologist. Dr. Gounder, I just want to start with that headline number I was just showing. We thought back in March when we were doing 30,000 plus cases a day that we were at the top of the hill. We're going up a new hill now. We're above 60,000 cases a day. What does that tell you? I don't know how to describe it. If we're on a racetrack, or will you give me the best indicator that a layperson can understand, where are we in terms of controlling the spread of this virus?
Well, right now, John, we're losing the race. The epidemic is accelerating in many parts of the United States. If you look at some of those curves, they're very much curves of spiking up, not flattening, not going down. And I think big picture, if we really want to go back to life as normal, if we want kids to go back to school, we need to do the work to get there. We've been putzing around for months now, not scaling up testing, not scaling up contact tracing, not wearing masks, not doing the work we needed to do. You know, where is that American toughness and resolve? It's been missing for months now.
Well, part of the missing, I suspect you would agree, is the Department of Mixed Messages, as I call it, in the sense that until he finally wore a mask this weekend, the president was saying, I don't think they're all that effective, and a lot of his supporters were saying it was some effort by the government to tell them what to do, not about public health. I want to read you. Dr. Anthony Fauci said this morning. It's almost as if we should say everybody should assume that you're an asymptomatic infected person, and that's the reason why you should wear a mask. Dr. Fauci says that, but as you're well aware, not to mix politics and healthcare, Dr. Fauci is under attack from his own colleagues in the Trump administration. They say he's too candid and he's too alarmist.
Well, unfortunately, public health in particular tends to be very political because it's about how do you prioritize and allocate resources. And so there's really no way to steer clear of that. Unfortunately, we're dealing with an administration that is making this even more partisan and political than it needs to be. But the science is very clear. You know, it's just kind of like universal precautions in the hospital. I wear gloves when I draw blood or do anything involving bodily fluids on every single patient because I have to assume every single patient might have HIV or some other bloodborne disease. Similarly, we out in public with other people should just assume everyone else, including ourselves, could have asymptomatic COVID infection, and we need to behave accordingly.
I want you to listen here to Admiral Giroir, who this morning in an interview I thought was quite candid. He said we have to get the virus under control, and if we get the virus under control, it would be safe for kids to go back to school if we get it under better control. He says you're not going to completely contain it. Listen to his take here on where we are with the troubling numbers.
But we're still very concerned because as hospitalizations go up, we would expect deaths to also go up. Even though we're turning the corner on the current outbreak, and it looks, all indications are that we have that, we won't see the benefit in hospitalizations and deaths for at least another couple weeks.
Sadly, we've had these conversations for months that there are lagging indicators. Hospitalizations follow cases. Deaths follow hospitalizations. When you hear the Admiral lay it out there, do you share his optimism? He says he does see, he's very candid about the current threat today and that we do not have this under control. But he says he can see some light at the end of the tunnel. Can you?
Frankly, John, I am not quite sure what he's reading into those numbers. To me, they're still very alarming, and I don't really see a sustained decrease of 14 days plus in any of the indicators, which is really what we need to be looking for. So, yeah, you might see little blips up and down, but that to me is white noise. That's not really a strong signal of improvement, and we really still need to commit to doing what needs to be done if we want to get this under control.
Dr. Celine Gounder, as always, grateful for your time and your insights. More importantly, grateful for your work every day. Thank you.